Welcome to the November 6th edition of the CART Community Discussions. This week's topic will be on REDCap and non-health data. And we're going to have a discussion today. We have a bunch of people that should be dropping in. So hopefully this will be of use some folks that are familiar with and not familiar with REDCap. And so let's open up the floor to discussion. So either my microphone is not working or everyone is feeling exhausted from the fallback time savings. All right, so REDCap, I know a bit about it. Before Internet 2, I was at the University of Missouri and I was the research computing director there. And we had lots of folks using REDCap in the medical school, but I had never heard of anyone using it for non-medical uses. So who here has an application that they're using for non-medical use of it? And you can just speak. You don't have to raise your hand. Yes, Erin.
All right. I'm happy to start off. So yeah, I'm at UC Berkeley. About, I guess, maybe 2 years ago, we spun up an instance of REDCap based on interest before that I got here that had, been expressed by particularly our School of Public Health, I think. So Berkeley doesn't have a medical school. And so it, I think didn't have REDCap for a long time because it wasn't necessarily kind of one of the first places that folks think to use REDCap, but the School of Public Health had a number of projects and research projects that were interested in using it. And so after a while, there was some funding through actually COVID, around COVID times, that was spun up in order to do tracking of COVID on campus. And so that was kind of the impetus to set up a REDCap instance locally. And so we primarily work with the School of Public Health. We don't have a huge number of users at this point. I would say we're probably in the under 200 range and under 20 projects in REDCap that are active and being used. But a lot of data collection in the field. So folks that are collecting data related to, in some cases, it is like health adjacent. So like telehealth stuff in countries in Africa and other states in the US. But we do have, for example, a group that's collecting field samples from rodents and people that are tracking, air quality and the effects on health in the Central Valley of California. So we've got a number of use cases that are not directly connected to a medical school that are kind of health adjacent, but uses of it that aren't as well. So happy to say more.
So given that I know enough to be dangerous, I have
Okay.
some questions, and others feel free to jump in, or I'll step back if there's not a lot of interest. But so what about REDCap makes it appealing for the type of data? Is it because it's kind of, you said health and health adjacent, is it because it's got a lot of like built-in fields and processing capabilities that can manage things that are associated with managing people with health?
Yeah, I mean, I would say one of the main features of it that distinguishes it too from like Qualtrics, for example, which we also have a campus license for, is its ability to collect data sort of longitudinally. So over either years or months or whatever sort of period of time, it does a really great and sort of powerful job of collecting that data, keeping it connected to, a person or a record, tying it over time. You can, many folks have used it to set up what's called in REDCap events. So different points of data collection where they want to collect specific type of information, being able to set up those sorts of surveys or forms, but keep it tied to a person or a thing over time. So that, I would say, that's the main benefit of it, especially compared to maybe other softwares and other data collection tools.
And that sounds like it could be pretty useful having it that kind of like longitudinal information associated with that. So
yeah, exactly.
I see Maureen has joined us.
So I apologize. There's been a lot of confusion about this call and the time. Because I thought it was at noon Central and others think, anyway, I need to send an email to Heather because I think she thought it was at starting now.
Well, we were just chatting about REDCap and some of the
Okay.
uses that folks have been, what it's good for, those types of things. So Maureen, do you want to continue doing those logistics while we survey the room?
Sure. I did send a call back. I sent an email back to Heather and Heather and Colin at Ohio State. So hopefully they'll join.
All right, cool.
Is Laura on the call? Don't think so. That's it.
All right. So how about folks in the call, put in the chat why you are, what interests you about this call? What kind of things are you interested in? Are you learning about REDCap for the first time? Are you a longtime REDCap user? What draws you to this call? You type that into the chat. And we do apologize. We got some confusion on there. Wendy. So Wendy says they want to hear how others were using it for non-medical research. Susan wanted to hear more about how it can be used for data capture. So if you're in the chat, thanks for those of you that answered in the chat. How many here have experience with Red Hat? You can just say yes or no. If you have an experience, say yes. Or use your reactions. I see. Well, Aaron is, again, then we have two people that are, there we go. Amy says they've used it for event registration. So what makes Red Hat attractive beyond the data capabilities? Is it easy to administer, or is it easy to use? Do the participants like it? What kind of things do folks find appealing about REDCap? As you can tell, I used to spend a lot of time in systems.
Yeah.
I mean, I'm happy to add just a little bit more. I would say that it's I would say that maybe from a user standpoint, it is perhaps a little bit, or it is more complex, I would say, to maybe set up and kind of get familiar with compared to something like Qualtrics or Google Forms for data kind of collection purposes. But it is something that, because there's such a large community, there's a pretty decent amount of information about how to get started and kind of use its basic functionality. But I would say just initially that it can be kind of hard for folks to get up to speed on, because it's not necessarily maybe intuitive, or the design of it looks very, I'll just say retro, maybe is one way to put it. But yeah, that's my experience.
It's been around for a while, in other words.
Yeah. Yeah, I think probably the biggest selling point, at least in the medical field, is it has the capacity to be compliant with all of the existing, sort of regulations. I think I have it in my presentation, but it's HIPAA compliant, it's CFR 11, I forget what FSMA compliant, that sort of thing. So out of the box, it's got all the logging and audit trails and everything that you need to ensure that it's meets the regulatory needs.
So one of the draws to it is its compliance capabilities then.
Yeah, which obviously probably contributes to its complexity. It's also free for nonprofits, which not an insignificant thing when you consider what some of this type of software costs for an institutional license. I don't know what we pay for Qualtrics, but it's quite a bit, would be my guess. So I'm looking to see, hopefully. So is Brian Gerard on? He was gonna do a short presentation. Heather and Colin were gonna do one. Michelle Lore. This could end up being a short call. People
Well,
who
that's the thing with you know, a lot of these kind of community calls is that a lot of folks can participate and give their input, and a lot of times you can get some pretty good discussions going on. So don't hesitate, those folks who have you know, some experience to contribute as well. That's how you build a community of practice, right? You bring folks together that are all doing the similar things, and you learn from everyone's interest points. And I would say if we get a really good discussion at some point in time, we can turn off the recording and then we can start complaining about REDCap and some of the embarrassing moments we may have had there. I know that's one thing about the academic community, is they don't necessarily publish their failures, you know, but in the research computing and data area, it's important to communicate those and share those, because you can save someone else a whole lot of pain, and you can learn a lot from other folks as well. So I encourage folks to contribute as well.
I guess I'd put a question out there for the people who are using it currently. Are you using it on a local server, or has anyone else set it up in the cloud?
We're in the cloud. We're in the cloud, AWS HIPAA environment.
In an AWS?
Yeah, but in a HIPAA environment.
Oh, in a HIPAA environment. Okay.
Yeah, yeah, they have this environment, but we don't use the AWS recipe for REDCap. Right, there's a recipe there. I don't know if they updated for setting up REDCap.
Mm-hmm.
We just use the regular Rob Taylor, his recipe.
Has anyone looked at the commercial product REDCap Cloud? Even aware of it?
I've had a tour of it. I would say it's primarily, it's very expensive. It's tailored towards Part 21, so doing all the compliance for that.
Mm-hmm.
I've heard other institutions that are heavy into REDCap outsource their Part 21 stuff to REDCap Cloud. When I had an overview of it, I did not even recognize it. They have so many customizations and some more granular security. It's an entirely different product and ecosystem and way of thinking how to do certain things.
Okay. Yeah, when I came on board as the research computing, we were running an old version of REDCap, and they wanted to update. And the person who had been managing the server, and I guess to a degree the application, or maybe it was primarily the application, had left or had been let go in a reduction in force. So they looked and actually signed a contract for REDCap Cloud before the end users who were the most interested, before they realized that it didn't actually meet their needs of what they were, or perhaps it was just so different that they weren't ready to migrate. I think they couldn't migrate what they were doing. And so that's when they turned to us and said, we need a new installation of it. So,
Their pricing model is also, I forget, but it's something like per user and per participant. So if you're just looking at fielding some low end, even if it is PHI or whatever, you're gonna, a very large cohort will drive you to bankruptcy.
Yeah.
That's not to say it isn't great. Like I said, to achieve Part 21, I mean, you probably need a huge staff and compliance team and hundreds and hundreds of pages of documentation. So if they can generate all that with one click of a button, to produce, FDA compliance documentation. That's probably the way to go.
Yeah. Georgetown has it in. Oh, okay. So Lisa, do they have a template for Google Cloud? I know they have one for Azure and AWS, but
We did it ourselves. We
you
didn't
did it yourself. Huh.
And was there, like, forgive my ignorance, if you're going with Google, is the pricing structure different from AWS?
I am guessing that they deployed it themselves. So AWS and Google are on par in terms of their costs. They are different how
Okay.
they do it, this, that, and the other, but basically they are very, very similar in cost structure. It's just how they're set up and how the billing looks and those types of things.
Okay. Thank you.
Depending on, so AWS and GCP have a egress fee. So if you were to do an extremely large study,
Okay.
the egress only counts on RNE networks. But since you might have a lot of participants coming off the commercial networks, there might be issues with the egress fee associated with that. So that might be something you'd want to consider before going to millions of participants, is to see how that scales up. Also, I don't know if a server could handle millions of participants as well. So
That sounds great. Well, thank you for that information. We're at dozens of participants right now, so.
then you're not going to notice the difference.
Yeah. Yeah, we're at probably hundreds of participants in our AWS setup. Our fees are running around $650 to $750 a month, just to give you a feel for that.
That's good to know. Thank you.
Do you have two instances or one? Because we have a QA for testing and then we have a production for production.
We have two, for the same reason. Depending on who all wants to present, I see Heather is on now, so maybe she wants to present soon, but yeah, we had a couple of hiccups getting going. Like a lot of people, when we start out on the cloud, we built kind of a proof of concept and then unwisely took that into production because of the push by the end users that they wanted it right now. So we had to rebuild, and then we had to rebuild again. So we're at a more stable point now where we have it configured in such a way that we can do the application upgrades without touching the environment. For whatever the previous build, it was set up in such a way that we had to rebuild it to do an application upgrade, but because they make it very easy to do the application upgrades, but yeah, that's if you're new to the cloud, it's seek a lot of help in setting it up correctly, because it's easy to rush in because you can get something up and going pretty quick. I mean, they do have templates, but if you don't step back and think about how you're going to sustain it, you can find yourself doing a lot of extra work down the line.
Yeah, we had a very similar experience. And I think that's just the end users, like by the time they're ready to do a longitudinal study, they're like, okay, we want REDCap right now.
Yeah.
And
Yeah. And like I said, we had an old version, and it rapidly was becoming untenable because we couldn't update the server operating system anymore because the REDCap was so out of date. I think it was running and still is running version 6. Yeah, it was untenable. There is still one project running on that, which fortunately is out of my purview, but we did what we could to move everyone over to the web, to the cloud version of it, and then said you are on your own, because we do not take responsibility if this server falls apart.
So I joined this conversation a little bit late. Our current strategy is we're still on-prem with our REDCap. We have 5 instances of REDCap in production. All 5 are on-prem in a variety or another. But we are embarking on a journey to stand up an instance of REDCap in the cloud, which is going to become our 21 CFR Part 11 validated instance of REDCap. So our strategy is to document that from the ground up because of the extensive documentation requirements that are required by Part 11. We thought that it would serve a number of purposes. It would give us that documentation opportunity to start fresh with a fresh install and not disrupt our production environment. But it will also give us a chance to get our feet wet into REDCap in the cloud without impacting current customers. So that's the strategy we are embarking on, and we're at the very beginning stages of that. We've engaged our MedCenter IT group, which is going to help us with the Azure bits. So we're hoping we will have that launched maybe by summer of 2024. I'm trying to be very conservative in my expectations. We have a large backlog of demand for an FDA validated instance of REDCap. So we've got folks that are chomping at the bit to have that out the door.
I think is it Matthew Peterson said that the cloud infrastructure, who said that the Azure template was out of date? Was it?
Yeah, I did.
Yeah,
We're
you did.
currently, Oregon State University is working with Microsoft to help retool that.
Okay.
To use 2023 best practices.
So Maureen, in terms of your deployment or anyone else, are you using tools like Terraform or Ansible or things like that potentially could be shared with the community to help them with a starting point? Because I know that can, even by looking at what someone else has done, can give folks idea in terms of how it was implemented, how it was split up, the service selection within the various providers, because that's an art in of itself to pick which service to host your data and things like that on.
So we're running on AWS. We started with a CloudFormation template that's on GitHub, which I think is reasonably up to date for AWS. We made some customizations of that template because we implemented security event and monitoring, security incident and event monitoring software. So we're using Cortex XDR, which is required by our central IT. We put it behind our MFA authenticator, which is Okta. And then of course we have to integrate with our email service for the email part of it. Those are the major changes that we've made. If I sound a little hesitant, the person who was more involved in it, unfortunately, is on vacation today, or I would have her maybe step into that. So we're happy to share out our template with others if you think that would be helpful. It's currently on a private GitHub, but I think we can certainly share that out if required. We are going to try and write a paper on it. I don't know if that's publishable, but we're hoping we can.
Yep. And we'll likewise have our documentation because of what we're doing with 21 CFR. We will have I expect we'll have a good deal of documentation of what we've done in our process, and we'll be willing to share whatever we can, whatever we get blessed to share.
Yeah. That hasn't been a request yet for us, although I can see where that would be coming down the pike. I don't know if you have to have that level of compliance to do consent for clinical trials. I'm not on the compliance side, but that's the next sort of big thing that I guess we're going to be doing with REDCap, is doing all the informed consent forms that way instead of by paper, which has been the traditional way. But as far as I know, we're not running any FDA trials at the moment.
We've been in pretty solidly in the e-consent space since COVID. We had a huge influx of requests for electronic consenting with COVID, so we've been running that for quite a while. But the part CFR part 11 stuff is a whole other level of
Yeah.
we have an e-consent template that we developed in-house that we use for our garden variety consenting.
Okay. So with the CFR part 11, do you have to run that in the Gov Cloud for Azure?
No.
Okay.
No. It can be completely. There are REDCap institutions that have validated their on-prem, so it doesn't even have to be in cloud.
Okay.
But our thought with doing it in cloud was we could leverage some of Microsoft's documentation that they've already done for government use. That they've already written some of the technical specifications and documentation for the use of Azure as a platform, and we could leverage that instead of having to start from scratch and documenting our on-prem infrastructure.
Okay.
And we're pretty solidly locked into the Azure ecosystem because of OSU's investment in the other Microsoft tools. So I don't know that AWS is even an option for us.
Okay. Yeah, we're pretty invested in Microsoft at the administrative level, but they kind of ignored us in research computing while we went off on our own to do all the cloud stuff in AWS, which is what we knew. So by the time they turned around and realized what we were up to, they were we were committed. It's bad.
Yep. That's how it happens. We had our research subscription of Azure long before our med center got on the train. And they're like, "Oh, you guys are already doing this?
Yeah.
Can we learn from you?" And it's been.
Yeah.
I'm just curious. So when you just have like a subdivision of the university are in the cloud, especially for compliance, then you know, the BAA you have with the vendor just cover your unit, right? It actually doesn't cover the university. So that's, you know, one of the considerations. So when we went into the cloud, we always, you know, if we actually put in HIPAA or any of the other data, so we always have the BAA directly. So for Google, we have the BAA directly with Google. You know, with AWS, because the contract was through you know, DLT with the internet too. So the BAA actually was with DLT. Then if you actually put anything with AWS, you need to have additional a direct BAA with AWS. So I don't know if people realize that.
So our contract we have a direct contract with AWS. So our BAA is directly with AWS.
Okay. Yeah, because we used to have, you know, researchers individually, they buy stuff in AWS, but the BAA they sign really doesn't cover the whole university.
Yeah. It shouldn't, I wouldn't think it'd be that big a deal for the university to obtain a BAA with AWS. It's AWS.
No, it's just paperwork. It's just additional legal paperwork.
yeah, if AWS thinks you're gonna buy more services, they're more than willing to do that sort of thing, so. What they're there for, is to sell you stuff. Susanna Liu asked, for those who have migrated from on-prem to cloud, what benefits have you been able to realize? I guess I mean, I can only speak to, we were forced into it because we lost the people who were managing our on-prem system, and central IT made it pretty clear they weren't going to hire anyone to do that. And so we really were in a position where we had to move to the cloud because they didn't want to set up more servers. Like I said, our costs are running 600 to 750 a month. I don't know how that compares to others, and I trying to think of how many. I don't off the top of my head know how many active projects that is. I could probably pull that information while we continue this conversation, but you know, that's what, 10,000 a year. If you had to hire a full-time person to manage a server and the application, you're going to spend a lot more than 10 grand, but that assumes that person, that's their only job. So but others may have had different experiences.
For Georgetown, I'm in the central IT. I used to manage the REDCap, the application. I'm in the central IT. So for us, the central IT actually we manage their server, and then the instance. So when we went to cloud, because the central IT's strategy is cloud first. So we kind of pretty much removed all the on-prem servers. So that's why the REDCap also went into the cloud. So the IT still, the instance is still managed by central IT. That way we make sure it's actually secure. And then it's all the instances up to date, patches are up to date. But then I used to manage the REDCap instance itself, and then doing all the upgrade, and then later on I pass it on to the group who own the application, because they also charge a minimal fee per project. I think that's how they cover some of the cost. And then so they hired dedicated application developer that to manage the application itself, the REDCap upgrades and user management and stuff like that. So I think that model works well. They don't have to worry about the system admin part. They only have to focus on the application.
I don't know protocol, so I don't know whether I should wait to be called on, or if it's okay that I'm just speaking up and interrupting. I just want to respond to that comment and say, Heather Lansky from Ohio State, who leads our REDCap team, is the founder and inaugural chair of a business of REDCap group in the REDCap consortium. So if anybody's interested in topics like that, she's a great person to talk with.
Okay.
And can you repeat her name one more time?
It's me.
Oh, Heather.
Right here.
Heather.
Yeah,
Oh,
right here.
Great. Awesome. Great. I've already got you noted. Awesome.
We have an inaugural meeting of that business committee coming up, I think next week, maybe.
Okay.
If you hop on the REDCap community, there's a whole discussion about it.
Okay.
And I'll go grab the date and put it in the chat.
Great.
Maybe one other thing about moving to cloud, if you've are doing it on-prem, is your license agreement still has to be with obviously with the institution. So you can't go to a third party and
Have a
say,
cart?
oh, I'm gonna hire a third party to do this cloud implementation and then ask them to pull down the license for you. It has to absolutely come from the institution itself. So that's, and they do state that, REDCap states that in the some of the details around obtaining that cloud template, but yeah. Support sign off on OIS. I'm just looking at some of the questions. So those who are also in the cloud, do you use your own Active Directory or your own authentication system for access to the instance?
Yes, we use the central authentication in the university.
Okay.
We use OpenID Connect.
Okay.
Yeah.
Temporarily
Yeah.
unavailable. Oh, the world?
Yeah, like I said, we're using the Okta, so it's connected to our Active Directory authentication, which wasn't that difficult. It's just a couple of it's a handshake, so that worked pretty well. I guess the other question was, or other comment, support sign off by the OIS SOC, I guess Security Operations Team or Security Operations Center. I think once we said we'd put it behind our authentication system, they were okay with that. IT doesn't have any AWS experience, so and we don't have a ton, so we did have to depend on third party groups to help us get this up and running properly. So oh, thanks Heather for the business model working group.
So Maureen, since we're coming up towards the top of the hour fairly soon, maybe you want to talk about next steps for this group if folks want to meet again, or where do we go from here? I think that might be an interesting conversation while folks are on the line.
So is there interest in sort of more of an in-depth dive into some of the cloud stuff, or I know the question was kicked off with what are the non-medical uses of REDCap, and I don't know that anyone's really talked too much about it other than one person at the top said they used it for event registration, which is kind of an interesting use for it.
We came with multiple topics. We came ready to present and by we, I mean Heather. So do we want, it's 12:47. Since we thought that that's what this meeting was about, is it okay if we kick off our presentation?
Sure.
Thanks.
So one thought is that a lot of folks thought this was starting at 12 o'clock Central Time.
Mm-hmm.
Maybe if you waited to, how many else here thought it was starting at the next hour? Put a raise of hands.
I was uncertain, but that's where I landed, was it was going to be at 1 o'clock.
Yeah.
Eastern time.
Okay, so if there's a lot of folks here that thought it was at 1 o'clock, maybe if we waited for 10 minutes and then started at the top of the next hour, you get more folks at potentially could miss it. I'm just putting that out there as a suggestion. So. Thoughts, Colin?
Yeah. I mean, Colin and Heather, are you willing to stay on? Maybe we could run till 12:30 if you want to do your presentation. And
I defer to Heather completely on this, and it's a good call out that there was some there was diverse information on the start time, and so I don't. There's people who thought it was starting at 1, and then there's people who have to leave at 1. So I don't know whether the total number will actually. I don't know what direction that'll go in as of 1 o'clock. Could do 12:55, and then everybody could, catch at least half of it, maybe.
Yeah, that would work well for me because I have another engagement that I need to leave for at 1:30. I have a hard stop there.
All right, and this is being recorded as well. So those of you who missed it, we can post this on the CARC YouTube website, and so folks can catch up on that as well. I'll defer to you folks where you want to start.
I'm flexible. I can stay on for another hour if other folks want to stay on and hear at least a couple presentations. And then is there enough interest, do we think, to have another one maybe sometime in December? Or I don't know if we should do a poll. No reactions one way or the other.
I think my presentation might be a little bit telling because I've got a number of topics, a number of directions I could go with my presentation. And depending on what interest is there, that could easily spin off to another presentation.
Okay. Well, then why don't we'll start with you and then see what at the end of that and see what the interest is in moving on from there.
Sure. Do we want to wait 5 more minutes or do we want to get started?
Since it's recorded, I think maybe why don't we just go ahead and get started and then we can go from there.
So Heather, what I'm going to do, I'm going to stop the recording and start it again, in case we want to just post just one of them, or it makes it easy to edit or not edit. So, Maureen, you want to do a quick say the date and do a quick introduction, and then we'll pass it off to Heather.
Sure.
Let me stop and start it again.